Hello, this is Dr. Prathima Setty, and I'm your host for this segment on ReachMD, the channel for medical professionals. Today we have with us Dr. Svetlana Katz-Nelson. She's an endocrinology fellow from Stony Brook University in New York. She will be discussing bringing humanism back to medicine. So wonderful to have you here today, Dr. Katz-Nelson.
Hi, thank you so much for having me.
Can you tell us a little bit about the program that you participated in during your fellowship?
This was pretty much right at the beginning of my fellowship. I had initially seen a patient of one of my attendings that had an insulin pump, and I was very new to that. It's something that I never managed, certainly in residency, and I spoke with her about all the different components of it and how challenging it was, and so I certainly wanted to learn a lot more about it. She had mentioned to me that we have these representatives that work with the patients that come in depending on which pumps that they have. And in particular, the Medtronics company, the representative was known to come in and offer to set up the fellows if they were interested in wearing the pump for about a week and, really training the fellows on how to check their finger sticks and essentially becoming a patient. So I certainly wanted to do this because as a physician was with a patient and here I was learning this specialty and had no idea of the device that they were using. I'm responsible for helping them maneuver and so forth. So I thought this would be a great experience to just learn a lot more about the pump and checking finger sticks and things like that. And I certainly ended up getting a lot more out of it than just learning the mechanics of how things worked.
So how long did you actually wear the pump?
It was about a week. I had met initially with the representative who came in. He sat down with me and explained how the pump worked, what I would do. Basically, I just became, at that moment, the patient.
Would you check your finger sticks 4 times a day and also do the insulin shots, or how did that work?
So the pump actually had normal saline in it, certainly rather than insulin. So the pump was attached to me, and essentially, instead of insulin, it would be normal saline that would go in every time I would bolus, or I would tell the pump that I needed quote-unquote insulin. And I was also set up with a glucometer, taught how to check my finger sticks, because this was really something that, even though we had a sense, coming from residency, I had a sense of how it was done, to actually sit down and really do it and prick your finger and then watch the glucometer give you that number. I mean, it was just a completely different experience.
What would you say was the most important lesson that you would take from that experience?
The most really important message that I walked away with was just how challenging it was to be a patient with diabetes. Just the various aspects of it. We tell our patients, make sure you check your finger sticks. And we don't, especially when you don't have diabetes and you don't do it yourself, don't realize how painful it is and how much of your time and such a component of your life it consumes, essentially. And sometimes, as practitioners, we may get a little bit frustrated when patients may not be checking as frequently as we'd like and so forth. I think it's very important to walk away from this remembering that this is really challenging. I think that it made me just so much more aware in working with patients. They're having difficulty, or even when they're doing well, just even commend them and to say, just to take a moment and to really appreciate the fact that they're able to kind of keep up and do this. And even if they're not, that's okay. And figuring out how to help, work with them and help them and really just not getting frustrated. So I thought that was a really, something that I ended up walking away with.
So how do you think that experience affected the way you're treating patients? I think you touched upon that a little bit.
Taking a moment with patients to both appreciate them. They have a disease that's very difficult to live with. They take up such a portion of their life because you have to make time aside in your day to check these finger sticks, to potentially write things down, to, if you have an insulin pump or you're on insulin, to take a moment and say, okay, I'm going to, have a carbohydrate. I have to cover that. I have to be aware of what I'm eating. And, to just really recognize that instead of just kind of, having a sense that they do it, but really going through it yourself. If patients do have trouble and they have difficulty with doing certain things, just really taking time to understand what they're up against. I think in a way it changed my rapport a little bit more with patients. It made me kind of always just try to take a step back in that visit because, obviously with the visits, there's a lot we talk about and there's a lot to get through, but really just to take a moment as a physician and really look at the patient and what they're going through.
So did your patients know that you were participating in this program? How did they react?
I'm trying to remember that week if I had anybody really realize it. There was one patient, I remember when I spoke to them, they seemed to kind of be a little surprised when I kind of made certain comments, and I had said, I also had worn this and experienced this and what you're experiencing. And I think that we kind of had like a little bit more of a connection where they felt like I understood a little bit better. And it's not that I walk away feeling like I completely know what it's like to have diabetes and know every aspect of it. And it wasn't like that. It's just I had developed such a better understanding of it, but they're really the ones that, live this every day.
If you are just tuning in, this is Dr. Prathima Setty, and I'm your host for this segment on ReachMD, the channel for medical professionals. Today we are speaking with Dr. Katznelson, an endocrinology fellow at Stony Brook, and she is discussing bringing humanism back to medicine. So, Dr. Katznelson, why did you decide to write about your experience?
The idea, actually, I have to say, came from my husband, who was watching me that week, and he had given me the idea to write the piece because I had made comments as I was going through that week, and I said to him, oh, no, I forgot to bolus for that, to basically, bolus, meaning cover that meal that I ate or cover that snack that I ate, or I would make comments throughout the week, this is very painful, when I'm checking my finger stick and I have to switch sites, and again, a lot of these things that my patients are going through. And he had actually made a comment and said, you really should think about sharing this. And that's actually when I thought about that. I thought that was a great idea. And it's not every day that we really put ourselves and get to experience what our patients experience, and this is one of those things that I was fortunate to do so because it really changed how I looked at diabetes, how I looked at my patients, hopefully will help me become a better physician. And I really just wanted to be honest and say, even as a physician, that being put in this position of having to take care of myself and do things that I counsel my own patients to do, that I had a difficult time with that. I was hoping that other physicians, would read this, especially physicians, but certainly patients are more than welcome to, and kind of start to get an understanding and really even just to take a step back in other diseases that maybe they manage, and maybe take a moment to think about what their patients might be going through and what we sometimes in the hurry of the visits and just kind of getting through a lot may, not always take time to do.
Yeah, that's a great point. Did a lot of your fellows participate in this program, or was it strictly voluntary just you?
This is fairly recent, I have to say. So to my knowledge, about one or two did do this. And, I spoke to them and they had very similar experiences. I think this is great. And I really think that they should consider making this a little bit more official and maybe other fellowships, because to my knowledge, I don't know that this is really such a set thing in other fellowships. But I think it's great on so many levels. Again, from just learning the kind of mechanics of things and really how first of all, the insulin pump works, which is a very complex device, I have to say, to really having the fellows learning the basis of what their patients do.
Do you think programs like this should be implemented everywhere and officially?
I think I do. Unless someone has some sort of objection to it, I think it can only really benefit us as physicians, and I think it ends up benefiting the physician-patient relationship, because I think, again, as physicians, we walk away with a greater, deeper knowledge of what our patients are going through. And a lot of times now when I just examine my patients and I look at their hands, my patients with diabetes who are checking their finger sticks, for instance, and looking at their hands and I see the calluses, it just, for that moment, you remember what, it's like and how painful it is and what they go through.
So, Dr. Katznelson, if we missed your article, where can we find it?
It's published on Medscape, www.medscape.com, and it would be under the endocrinology section.
We'll be sure to look that up then. Dr. Katznelson, thank you so much for being here with us today. That was a wonderful experience that you went through and definitely gives us a new way of looking at our patients. So thank you for being here and sharing that with us.
Thank you so much for having me.
This is Dr. Prathima Setty, your host today for this segment with ReachMD, the channel for medical professionals. Thank you so much for joining us.